This video talks about some common situations facing teenagers living with epilepsy. Going through puberty is an important process for any young person. During this time, your body is going through a lot of changes. In most cases, these changes will not have much of an impact on your epilepsy, although this isn't always the case. You might notice an increase or change in your seizures at certain times of the month, or your seizures might stay the same. It depends on the person. If you notice anything unusual, talk to your doctor and parent and guardian about it. It's sometimes a good idea to keep a seizure diary, which can help your doctor understand your situation and give you the best advice. Talking about your epilepsy with others can be hard sometimes. It is normal to feel a little awkward or nervous, but luckily most people will be understanding and supportive if they have the right information. You might be comfortable telling everyone about your epilepsy, or you might not. The decision is up to you. Think about what people need to know most and what would make you feel safe and supported. You might not want to tell people about your epilepsy at all because you don't want them to act differently around you. This is totally understandable. But if you talk about your epilepsy in a positive and straightforward way, it is likely that others will follow your example. Secondary school is an exciting journey, and doing well in the classroom is only part of it. Your journey might involve making new friends, getting involved in extracurricular activities, and even dating. Your epilepsy doesn't have to restrict you every step of the way. If you need support with school life, make sure you talk to people like your parents, guardians, teachers, school counselors, as well as your doctor. You don't have to go it alone. It is likely that you will have a mix of friends as you grow up. Some may even have epilepsy or other health conditions like diabetes or asthma. Some will be into sports, while others will prefer to chill out inside and read or watch Netflix. There are, however, some special challenges that young people with epilepsy face in maintaining a social life. One of the biggest impacts is driving. This is because your ability to have a driver's license depends on your seizure control. Basically, you have to be seizure-free and on medication for a period of time, depending on your circumstances and what the law says in your state. Speak to your doctor about how your epilepsy affects your ability to get a driver's license. In the meantime, there are other transport options if you are too young to drive or if your seizures affect your ability to get/have a license. Use public transport. Get an Uber or taxi. Ask a friend for a lift. You can ride your bike. There are some common seizure triggers, events that lead to a seizure, that you can look out for. These include lack of sleep, not taking your medication, being tired, stressed, hormonal changes, illness or fever, diet, prescription medications, flashing or flickering lights, alcohol, or illegal drugs. Many people feel misunderstood and lonely during their teenage years, regardless of whether they have epilepsy. However, you don't have to struggle alone, as there are always other people who want to help. People who might be worth chatting to include your parents, close friends, doctor, psychologist, or school counselor, or the many other organizations you can contact for support.